Extract 1. Questions 1 to 12. You hear a nurse talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please have a seat. What brings you in today?
Thank you. I've been experiencing some itchy and red patches on my skin for the past few weeks.
Where are they found? Throughout the body?
They're mostly on my elbows and knees, but I'm starting to see some on my scalp too.
I see. Could you describe the patches further? How do they look?
Yes, they're slightly raised and they definitely flake, especially when I scratch them. It's quite embarrassing, to be honest.
I understand. How long have you had these symptoms?
It started about 2 months ago, but it's gotten worse recently. It's affecting my social life because I'm constantly worried about how it looks and I feel self-conscious.
Have you tried anything to treat the patches?
I've been using a hydrocortisone cream over the counter, but it doesn't seem to be helping much.
Okay. Do you have any other medical conditions?
I don't have any major health problems, but I do have hay fever seasonally.
All right. Is there any significant family medical history we should know about?
My father does have a history of eczema though. My grandmother had something similar to what I have, but I'm not sure what it was called.
Thanks for that information. Do you have any stressful occupations or habits that might be contributing to the symptoms, Mihiraa?
I work as a business analyst, which can be quite stressful at times. I also drink a lot of coffee, and I know that's not great for my skin.
Based on your description, it's possible you might be experiencing symptoms of psoriasis. However, I am not qualified to provide a diagnosis. To accurately diagnose skin conditions and discuss appropriate treatment options tailored to your needs, which may include specialized creams, medications, and lifestyle adjustments, I highly recommend scheduling an appointment with a dermatologist.
All right. I will consider that.
In the meantime, I suggest you continue using a fragrance-free moisturizer and avoid scratching the patches.
Okay, thank you so much for the information and the referral.
You're welcome, Mihiraa. I'll make sure to provide you with a leaflet to read. I hope you get some relief soon.
That would be of great help.
Extract 2. Questions 13 to 24. You hear an occupational therapist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Hi Mihiraa, it's good to see you. I'm Carl's Jeans, your occupational therapist.
Good to see you too.
So, Mihiraa, your GP mentioned that you recently experienced an avulsion fracture. You've been referred to me by your GP to assist with your recovery. How are you feeling today?
It's still a little sore, especially when I try to grip things. But it's definitely getting better.
That's good to hear. Now, do you have any understanding of what type of fracture you have, and how it affects your hand?
Doctor explained to me, but not really, to be honest.
Okay, no problem. I can explain it in more detail. Essentially, the fracture is a small piece of bone that's pulled away by a tendon. This can cause pain and weakness in the affected area, making it difficult to carry out daily activities.
Oh, I see. That makes sense. And literally it is.
Mihiraa, as an occupational therapist, My role is to help you regain your independence and improve your function in everyday life. This can involve exercises to strengthen your hand and improve its range of motion, as well as suggesting ways to adapt your daily routines to make them easier. Now, can you tell me a little more about your lifestyle? Do you work? What kind of activities do you enjoy?
I work as a seamstress, so I use my hands a lot. I also love gardening and cooking.
Okay, Mihiraa, thanks for that information. Based on your lifestyle, it seems like regaining hand function is essential for you.
Yes, absolutely. I rely on it for my livelihood. I'm finding it challenging to perform certain tasks both at work and at home. At work, cutting fabric accurately and manipulating heavy fabrics are particularly difficult. Pursuing my hobbies, such as sewing or knitting, has become almost impossible due to the limited mobility and discomfort in my hand. At home, simple tasks like buttoning shirts or tying shoelaces have become quite cumbersome.
I truly understand. To help you manage these tasks, we can discuss some home modifications. For instance, we can consider using sewing tools with larger grips and ergonomic designs, to make handling them more comfortable and manageable.
That's great.
Moreover, there are specific pieces of equipment that can be helpful. We can consider things like splints to support your hand while providing a range of motion, and therapy putty to strengthen your grip. How does that sound, Mihiraa?
That makes sense. Definitely, that's doable.
The recovery process from the fracture generally occurs in distinct stages, Mihiraa. Initially, our focus will be on alleviating pain and reducing inflammation through appropriate measures. As your condition stabilizes, we will gradually transition towards restoring full strength and dexterity to your hand. This comprehensive approach ensures a systematic and effective recovery journey tailored to your needs.
I truly appreciate your thorough explanation. It has provided me with a clear understanding of the process ahead. Thank you for your time and attention to detail. It's incredibly reassuring during this challenging time.
You're welcome, Mihiraa. We'll work together to develop a personalized plan to help you achieve your recovery goals.
That is the end of Part A. Now check the answers.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.